Good morning. This is Perspectives. I'm Celeste Baranyi. This morning, my guest is Justin Chenette. He is the Senior Director of Public Relations and Advancement for Sweetser. Good morning, Justin.
Thanks, Celeste, for having me. Really looking forward to our conversation.
Let's start off with, what does Sweetser do?
Sweetser does everything. Do we have a whole hour? Sweetser is a behavioral health nonprofit, as you know, but we provide evidence-based treatment, support, and hope really through a statewide network of community-based mental health, recovery, and educational services. We've been around for nearly 200 years, which not a lot of organizations can say they've had that rich history in our state. We actually started out as a children's orphanage in the early 1800s, and we've been serving children and families ever since. And obviously, we've had to adapt along the way based on the needs of Mainers. Obviously, mental health is a really big topic right now, and we're just trying to meet that moment.
You mentioned mobile crisis. Could you tell us a little bit about your mobile crisis services? Because they are so important, operating 24 hours a day, 7 days a week.
We're the largest provider of mobile crisis services in the state, and how I like to simplify it is we meet you where you're at. So obviously, when you're in the midst of a mental health crisis, it doesn't always happen in a convenient location. And oftentimes we see, in terms of calls from law enforcement or other folks passing on the need, a crisis could occur under a bridge. It could occur at a place of business. It could occur in a primary care office. It could occur in random places. And I think it's really important that, these teams are out meeting that need in the community. And so as the largest provider, what ends up happening is someone would call the 988 number, and luckily that's a national effort to really make it simple for folks to remember a number when you're in the middle of a crisis or of somebody in a crisis. So there used to be a longer statewide crisis line number, which people could still call, but 988 is going to be life-saving. It's going to be easier for people to remember. And so we did over 4,000 mobile crisis interventions last year alone. 4,000. So that just gives you an idea of the need. That gives you an idea of how important these services are. Again, mobile crisis is about going out and meeting folks where they're at and helping them through very difficult circumstances. And again, sometimes we're going out with law enforcement or responding to a situation where law enforcement is involved. That's not always the case, but that tends to be a significant call volume. And then we're also working with those individuals beyond just sort of stabilizing them in the moment. What about the long-term needs of that individual and individualizing that treatment and care?
And so that's where their comprehensive crisis plan comes in. Is that correct?
Absolutely. And so it might be around providing more residential support. Maybe they need to be in an environment where they have sort of constant professional and licensed support around them. It might be around accessing community-based services. So maybe it's something like our behavioral health home program where, we're going out to the individual's home or apartment, wherever they're living, and ensuring that they have the kind of wraparound care that is needed. And so it really depends on the individual and the circumstance. I think the important thing for folks to remember is that, we have folks on our team that can really help folks walk them through based on what they're experiencing, their symptoms, their anxieties, their feelings, their emotions, to really craft something that's going to work for them. They don't have to worry about all the acronyms. They don't have to worry about all the different services and programs because it can feel intimidating just to figure out, how do I reach out for care and support? And so let us worry about that. Let us handle that, and we can walk you through that.
And how is Sweetser planning to meet the growing need that you were speaking about earlier for services across the state?
Well, a couple things. Number one, we just opened up a new certified community behavioral health clinic in Stanford. We're really excited about that. That's going to help us serve 750 more people in that area, and that is an area of particular need. And this model of care, this sort of clinic model, ensures that you can walk in and get access to care on the same day. And that, again, can be life-saving. When you're needing help and support, and then you're told, I'm going to have to be put on a wait list, or, that it's really not available, that closed door can be really difficult. And so this is why the federal government is really expanding this particular clinic care model across the country. They're investing in the state of Maine, and that's why we're able to expand this not just to Sanford, but we're also identifying Lewiston as another area of expansion for services because they need a walk-in care model. We're hoping later this year to actually open up an expanded clinic in Lewiston. So we're working towards that. But so far, that model is really going to be helpful. And I think the end goal is really to have a clinic in every single county, at least one in every single county, so that more folks can be able to reach and access care.
Justin, for people who just need someone to talk to and they might not know which service or program they need, what can they do?
Absolutely. So if you're just like, I need to figure out what service or program is right for me. I know I need some help, but I need to know where to start. They can contact our Promise line, and that's 1-800-434-3000. Or they can email us at info@sweetser.org. And again, we have an access team that can kind of walk them through the process and kind of figure out what's available, what do we have openings, and where do we have openings. If you're just wanting to talk to somebody who has had lived experience, so somebody who has had a past mental health challenge or even a substance use challenge, we have what's called the Peer Support Line. This line is available toll-free from anywhere in Maine, 24 hours a day, 7 days a week. It's staffed by people, again, who's basically been there, and they offer mutual conversations with somebody who's not just who's been there, but who's trained to help you through difficult conversations. And I will tell you, these phone conversations are not like trying to get in and out quickly. The average phone conversation is about 30 minutes. And last year alone, we had over 26,000 calls that we serviced with the peer support line. So again, just seeing that volume of calls, and some of them are frequent callers. Some folks, maybe they've set up on a schedule where like every week they need to touch base with somebody. We know feelings of isolation can be deadly. We know that sometimes people, either in rural parts of our state, or it could be seniors, it could be other folks that are just struggling and they need to talk to somebody. These peer support specialists are really there for them. And so this is just an incredible program. And to speak to some of our peer support specialists who have been there, 10, 20 years, they can go home every day knowing that they really made a difference to that person. And it sounds so simple, just having a phone conversation, but it really does matter. And it really matters that the person on the other end of the phone has a true and authentic understanding of their experience, because it's one thing to provide lip service. It's another thing to be like, you know what? Totally been there. And to have somebody be able to listen and to lean on and who's trained in having those conversations, that's incredibly important. So that phone number, the peer support line, it's 1-866-771-9276.
And you can find all of these numbers at Sweetser.org as well. Justin, what are some of the barriers to accessing treatment and professional mental health support?
There's a couple of things. One, I would say most organizations that do this work that are in the behavioral health field have some form of a wait list. Sweetser alone has nearly 2,000 people on a wait list for various services. And that's just a staggering number. That's just us, and every organization has some version of that. And I think one of the things that is sort of centered around is the need for a greater workforce within the state of Maine to help serve more people. You can't have services without staff, right? And so I think one of the things that we want to openly encourage is young people, students, to think about going into behavioral health as a wonderful field of choice for college, for graduate school. That's really important. We also want to consider maybe there are folks that are on the cusp of retirement, or maybe who have just recently retired and see this incredible need that we have across the state and want to maybe open up their own practice, take on a few clients to get folks off the wait list. We make that really easy. We have an affiliate network of independent providers across the state where, again, we take care of like all the administrative work of like essentially running your own business, and they can focus on like actually helping people. And so I think that that's a big need for us. And I think one of the things that we're doing is working with our legislative partners to continue to kind of think about, how do we encourage, incentivize, and make it easier for folks to go into the behavioral health field. I would also say we need more state support from the legislature, from the governor, around certain programs. For instance, our school-based program. So this is where we embed a clinician on school campuses across the state. We have about 100 schools that we do this with across the state. That's just Sweetser. And these school-based clinicians are able to work not just with the student, but with their families, because we often see that's where some of the issues lie. And this is natural supportive care. This is the easiest way of getting mental health support to young people, which we know we're in the midst of a youth mental health crisis. We lose money on this program every single year. We're going to lose well over $1 million just on this program. That's not sustainable for anyone, business, organization, government, you name it. That's just not sustainable. And so we're encouraging legislative solutions around this. But, this is going to be really difficult because we need to be investing more in youth mental health support. So I think that's another example where the financial barrier to accessing care or to providing care is troublesome. In the same vein, Sweetser does provide care for folks who have an inability to pay for that care. Maybe they're underinsured, they're uninsured. And so we provided over $1 million worth of care just for that in and of itself. And I think, again, that has to come from somewhere. And so it really comes from the generosity of the community.
And speaking of the generosity of the community, how can we donate to Sweetser? And are you looking for volunteers? And you mentioned job openings. Staffing is always an issue. How can we donate and how can we volunteer?
Absolutely. So we've started the Mental Health Matters Fund, especially for May Mental Health Month that we're in right now, to really ensure that treatment is available regardless of someone's ability to pay. That should not be their first focus. Their first focus should be on recovery and healing. So you can visit sweetser.org/donate. You can also text the word Sweetser to 366. 283. Businesses could also sponsor events. We have a number of events that we do throughout the year, including our Golf Classic in Old Orchard Beach. We have a benefit concert coming up in July in Arundel, and we have our annual fall live auction that's going to be held at Brick South on Thompson's Point in September. So really excited about a few of those things coming up. We're also always looking for interns and volunteers. And of course, if you're interested in becoming an affiliate, you're wanting to go into the field of behavioral health, I think we have some 90 openings right now across the organization throughout the state. You can, again, see those openings at sweetser.org.
Once again, May is Mental Health Awareness Month, and thank you so much, Justin, for talking to us today about all the programs at Sweetser, and our listeners can go to sweetser.org to get more information. Thanks, Justin.
Thanks, Celeste.
We've been speaking with Justin Chenette, Senior Director of Public Relations and Advancement for Sweetser. I'm Celeste Baranyi. This has been Perspectives.